Good morning, everyone. Today I will talk about the basic aspects of allosteric modulation. It is a new concept, a promise for better drugs for tomorrow. It is recently recognized as a pharmacodynamic characteristic. Allosteric modulation is increasingly being explored today to offer therapeutic advantages. The science is rapidly advancing. It is shown to occur during interaction with a key enzyme, protein, a ligand-gated channel, or more importantly, receptors. In this discourse, I will discuss only a brief about drug-receptor interaction and its allosteric modulation. The receptors for drugs are of various types, as we all know, and among them G-protein coupled receptors are present ubiquitously in most of the organisms and tissues, including human cells. Thus, I will be discussing just on the allosteric modulation of G-protein coupled receptors in this. As we all know, G-protein coupled receptors are helical several transmembrane structures having the outer domains and the inner domains, and N-terminal extracellularly and C-terminal intracellularly. There is a hinge linker that connects the extracellular domain with the membrane helices. This hinge also plays a role in agonist binding and allosteric modulation. The 7 transmembrane domains have 3 extracellular and 3 intracellular parts or loops that can bind to a variety of endogenous ligands such as hormones, neurotransmitters, and many drugs. It is found that allosteric modulators act on the transmembrane portion of the G-protein coupled receptors. Intracellular signaling occurs once there is a binding of drug on the receptor, and activation of G proteins and or beta arrestin pathways simultaneously or differentially will result in increase or decrease in a cellular function. Now, if there is a preferential activation of one pathway over other, then it is called as functional. This is a general concept, not the details. This is how a receptor is bound by a ligand, an agonist, and here conventional receptor binding is orthosteric agonist binding on G-protein coupled receptor that activates intracellular signaling pathways resulting in a response. One may remember that a response can be a contraction that is positive or can be relaxation that is negative, but it is an overall excited. There are two functional binding sites on G-protein coupled receptors. The one which I discussed earlier is orthostatic binding site for the agonists, and there is another site of binding for the ligands and drugs which is adjacent to orthostatic site and provides another binding site for several number of the new molecules. Hormones and endogenous ligands bind on a specific extracellular domain amino acid sequences, and it may also involve hinge regions. So binding of orthostatic agonist will be on a specific part of the receptor, and here both agonist and antagonist bind depending on their intrinsic activity. The conformational changes will result in intracellular signaling through multiple pathways. The mechanism of receptor activation is highly conserved. So long as orthosteric receptor is concerned, the mechanism is highly conserved, as is observed with various types of the muscarinic receptors subtypes 1 to 4. And thus it is very difficult to develop highly selective orthosteric agonist or conventional agonist or antagonist for subtype muscarinic receptors, because the amino acid sequence remains same. There will be difficult for several ligands to differentiate such sequences among the subtype of the muscarinic. Drugs that bind to same receptor but do not prevent binding of agonist, they act allosterically. The site of binding is always different, away or separate to the orthosteric binding site of the receptor. For example, muscarinic subtype receptors possess one or more topographically distinct binding sites. We call them as allosteric binding sites, which consists of amino acid side chains which are located within the extracellular loops or the outer segment of different 7 transmembrane G protein couple helices. And these are the sites, we call them as allosteric sites. Allosterically bound drug interferes with the dissociation of the bound orthosteric agonist or antagonist from its own receptor, that is orthosteric receptor, and thus modifies the effect of the orthosteric agonist. Now, differentiating several allosteric modulators, they can be positive allosteric modulators or PAM. They are also known as allosteric facilitators. A ligand that enhances agonist effect on receptors, thereby increasing efficacy, affinity, or both. The resultant effect can be further stimulation or inhibition of the activity. Conversely, a negative allostatic modulator, NAM, or allosteric inhibitor, is a non-competitive or inverse agonist ligand that attenuates agonist affinity, potency, or including efficacy. So these are the differences between a positive allostatic modulator and negative allosteric modulator. Little complexity is added because there is a description of neutral allosteric ligands, nulls, and these do not affect the receptor activity of the orthostatic ligand, but they block the activity of NAMs or PAMs. So that is very important. They don't have their own activity. They modify the NAMs and PAMs. So they are known as silent allosteric modulators. And the most exciting discoveries are being made, and the new terminology comes up is bitopic ligands. That is, the drugs or newer chemical entities that target both sites on a same receptor, orthosteric site and allosteric site simultaneously, and therefore it may achieve higher affinity and subtype selectivity. Work is underway to identify M1 selective and CB2 selective bitopic ligands. This is how it can be depicted when an allosteric ligand binds with its site. It modifies the orthostatic agonist activity, and the activity may be modulated as a positive or as a negative. Sometimes allosteric modulator may act as agonist by itself because of its intrinsic activity. It may act as an agonist, therefore it may directly give a response in the form of either stimulation or. So now with these backgrounds, what are the allostatic modulators? A variety of binding sites for different ligands are found on G protein couple receptors, and once they bind, they result in conformational changes of the orthostatic active site of the receptor molecule, thereby altering its activity in the form of affinity, potency, or intrinsic activity, therefore changing the downstream intracellular signaling pathways. If there is preferential downstream change, it is known as bias signaling. Some allosteric modulators may also activate receptor by itself, which I told you is called as own agonist effect. Examples were there, but other examples are adenosine 2A receptor, dopamine D2 subtype receptors after heterodimerization may result in activation response. Almost a similar thing may happen with gonadotropin receptors, which can be stimulated by experimental allosteric agents because of lack of specificity of allosteric binding sites, because which are less conserved compared to more conservation found in orthosteric sites. Such allosteric modulators will result in formation of a hormone receptors or homodimers or heterodimers which have their own activity. So there is quite an exciting work being done in this aspect. Examples of NAMs and PAMs are coming up rapidly. For example, the conventional mechanism of action of the barbiturates and benzodiazepines have been finalized as they are PAMs at GABA A receptor. Therefore, benzodiazepine potentiation of GABAergic inhibition by benzodiazepines is because benzodiazepines are positive allosteric modulators of the receptor. We know that there is a separate binding site for benzodiazepines and there is a separate binding site for barbiturate as compared to the GABA binding site. So they are allosteric modulators. Other examples are many CNS depressants, anti-epileptics which act by GABAergic mechanism are in fact the allostatic modulators or positive allosteric modulators. The Z drug hypnotics are also allostatic modulators. Other examples are PAM at calcium sensitive receptors, they are known as type 2 calcimimetics, sinacalcet and acetylcalcetide are used for the treatment of secondary hyperparathyroidism in chronic renal disease. A neurosteroidal PAM at GABA A receptor is brexanolone, and this is a pregnenolone derivative, and it has been recently approved by FDA for the treatment of postpartum depression. Positive allosteric modulators of the potassium channel subtype 2,5 is retigabin, the other name is ezogabin, and it is found to be having an anticonvulsant activity due to reduction in the burst activity due to hyperpolarization. A mixed acting antagonist at NMDA receptors may have a PAM activity on GABA A receptor. Acamprosate is a well-known drug for the treatment of alcohol withdrawal abuse, and it normalizes the dysregulated neurotransmitter, and therefore it is very helpful in preventing relapse. Recently, a PAM at AMPA receptors, which are a type of the NMDA glutaminergic receptors, they are known as empakines. Many new empakines are being developed, but piracetam and phenylpiracetam, they are known cognitive enhancers, and they are actually considered now as PAM regulators at AMPA receptor level. Like PAMs, there are also NAMs, and these NAMs are also very specific particular receptor subtype. Selective NAM at glutaminergic receptor is a phenopom which has angioselective action. A non-competitive NAM at CB1 receptor is a cannabidiol. Is a drug which exerts so many actions, but one important action is anticonvulsant action because of the NAM activity at CB1 receptors. Allosteric inhibition of the serotonin transporter and multiple effects as partial agonists or antagonists at various subtype serotonin receptors is shown by virtue of Zeten, a drug which has been developed for antidepressant activity with less adverse effects. NAMs block, that is, block of the ADP binding to the orthosteric site of the platelet P2Y12 receptors. The important drugs are ticagrelor and cangrelor. These are very important drugs, extremely helpful in ischemic heart disease, and their antiplatelet activity is predominantly due to NAM activity. So that's very important to explain the underlying mechanism of action. A NAM that blocks the binding of HIV outer envelope protein glycoprotein 120 to the cellular CCR5 receptor. Therefore, inhibit fusion and entry. One entry blocker is Maraviroc, which has anti-HIV drug, but it shows NAM activity at the receptor. There are many other recent developments which can be discussed. For example, the central nicotinic receptor subtype alpha 7 is involved in pain perception and cognition, and development of PAMs at these receptors are exciting to the treatment of schizophrenia to improve cognitive function, because many of antipsychotic drugs may adversely affect the cognitive function when used for the treatment of psychosis. PAMs at D1 receptors are shown to have more limited effects on D1 receptor stimulation. Therefore, they may prove successful as cognitive enhancer without adverse effects. A number of PAMs and NAMs for opioid receptors are also in preclinical stages of development, and allosteric modulation may occur at targets which actually lack a non-orthostatic binding sites. What does it mean is that there may not be actually orthostatic site or a receptor or conventional receptor where agonist binds, but allosteric modulation may occur, and this example is ivacaftor that binds to cystic fibrosis transmembrane regulator CFTR that is controlled by gene. It is an ion channel that is mutated in cystic fibrosis. This CFTR naturally does not have any non-endogenous ligand or hormone normally. Investigational gonadotropin PAMs are many actually. Thiazolidinones, dihydropyridine derivatives and antibodies. They are being investigated as preferential drugs for infertility, polycystic ovarian disease, and produce controlled ovarian stimulation for in vitro fertilization. The NAMs are also being developed at follicle stimulating hormone GPRC, and they have been investigated as specific contraceptives which do not have much adverse effects of oral contraception. Similar NAMs and PAMs are also being developed for LH hormone, that is gonadotropin, and thienopyrimidines, and the investigational naphthalene derivatives are BA298 and 899. A number of characteristics have been shown for NAMs and PAMs at these gonadotropins, and they are small molecules, they have oral activity, and they are resistant to peptidase inactivation. Therefore, these peculiarities make them the preferential investigational drugs for further exploration. And LH PAMs have been found to be alternative to LH and SCG, and for ovulation induction and increasing testosterone formation. Whereas LH NAMs are being developed as non-steroidal. Now, one interesting finding is that is the biased agonism related to allosteric modulation. Now, it has been found that PAMs and allosteric agonists may activate only certain specific signaling pathway preferentially. For example, activation of beta-arrestin pathway versus activation of G protein related pathway. That means either GTPase activity or beta-arrestin activity preferentially being activated. and this is known as functional selectivity. The other name for functional selectivity is biased agonism. Now this biased agonism has been shown by modulators at adenosine subtype receptors and muscarinic subtype receptors. Therefore, a few drugs are being developed with signaling efficacies which are biased or selective. Flumazenil is an example of exciting efficacies. Flumazenil antagonizes BDZ as a competitive antagonist because it binds on the BDZ site of the ionotropic GABA A receptor complex. We now know that BDZ site is an allosteric site. What does it mean? That PAM is actually antagonizing an allosteric stimulant or agonist, that is BDZ. Of course, the net effect is negative. But is it that flumazenil, which is conventionally called as competitive antagonist or partial agonist, is actually allosteric antagonist? So I personally feel yes, flumazenil is an allosteric antagonist, and it explains how it is in contravention to conventional understanding of an antagonist at orthostatic site. Now, if some non-competitive antagonist shows antagonistic activity because it binds on the other side rather than orthosteric site. S-ketamine binds non-competitively at the allosteric site of NMDA receptor. Such antagonism is actually due to negative allosteric modulation. So, flumazenil is actually allosteric antagonist because it antagonizes BD and that itself is an allosteric, positive allosteric agonist. Potential advantages of allosterism is mitigation of tolerance. PAMs may avoid the receptor desensitization and downregulation which is seen with chronic use of orthostatic agonists. We also now know that orthostatic binding sites, their amino acid sequences are well conserved across the generations. Therefore, subtype selectivity will not be seen for orthostatic sites, but subtype selectivity will be much prominent with the allostatic modulators. And actually efforts are being done to find out the subtype selective muscarinic agonists and their therapeutic utility. Key references are given, and I hope that some basic understanding must be developed among the students after going through this work. Thank you.